Good morning. My name is Nachi Choklingam, and I'm the Director for Center for Biomechanics and Rehabilitation Technologies here at Staffordshire University. Welcome to our online event to launch our new healthcare framework focused on telehealth from Staffordshire University's television studios here in Stoke-on-Trent. We're delighted to have you here with us today as we unveil this important resource that has been developed to address gaps in telehealth provision offered by allied health professionals within the UK National Health Service. Telehealth is the use of technology to deliver healthcare services remotely. It includes the use of video conferencing, mobile apps, and other digital tools to connect patients with healthcare providers, regardless of their location. Telehealth has become increasingly important for several reasons, such as improving accessibility and providing cost-effective delivery of clinical management. This framework that we are introducing today from snowy Stoke-on-Trent is a result of extensive research collaboration with various research stakeholders, clinical stakeholders, including allied health professionals, policymakers, and healthcare organizations. The COVID-19 pandemic has greatly accelerated the adoption of telehealth as it became an essential tool for providing healthcare services whilst minimizing the spread of the virus. Due to the need for social distancing and the strain on hospitals and other healthcare facilities, traditional inpatient care was difficult to provide. This has led to a rapid shift towards telehealth as a way to continuing delivering care to patients, minimizing the risk of infection. Although the COVID-19 pandemic has forced us to adapt to new technologies and telehealth has become a vital tool in providing care, our research over the past couple of years has shown barriers and issues faced both by clinicians and also patients. It might not be today, but we are excited to hear your thoughts and feedback on our research and the framework that we are launching today, and we look forward to engaging with you very soon. We are very honored to have esteemed guests, experts, and thought leaders from various parts of healthcare sector, both here in the UK and across the globe, joining us today to look at the framework, what it can offer, and its potential implications. Thank you for joining us today, and let's get started. I have great pleasure in introducing my colleague Nikki Edison, who will provide a background to this work from an NHS context. Over to you, Nikki.
Thank you, Nachi. I'm Nikki Edison, an Associate Professor at Staffordshire University and a Consultant Orthotist at the Royal Wolverhampton NHS Trust. The use of telehealth is not new. The global evidence appears to support telehealth consultations as an effective, accessible, and cost-effective method of service delivery. It has been estimated that more than 60% of all healthcare institutions in the USA utilise some form of telehealth. Here in the UK, telehealth has historically been used to provide healthcare access to patients living in remote locations. However, the COVID-19 pandemic resulted in a rapid shift to remote consultations across the breadth of the NHS. Rapidly redesigning how allied health professional services continue to deliver care by adapting to the restrictions imposed by the pandemic was significant. It resulted in a rapid expansion of telehealth as an alternative method of delivering healthcare. Our research showed that at the start of the pandemic, 22% of UK orthotic services closed completely, followed by a rapid introduction of telehealth by 66% of orthotic services in an attempt to ensure patients could access the service. 90% of all orthotists who took part in our study reported using telehealth consultations in their service. The resulting rapid digitalisation of NHS services with the introduction of digital technology and innovation to provide telehealth consultations has raised concern amongst the public, the media, and within the scientific literature. Concerns have been raised around equity of access. It has been reported that socio-economic factors significantly affect patient access to healthcare due to the cost of internet access, digital poverty, poor digital literacy, exclusion due to hearing or visual impairment, cognitive impairment, and having a lack of suitable space to carry out a telehealth consultation may all result in inequities of care when accessing telehealth. The potential inequity of access to healthcare via telehealth consultations amongst populations may lead to widening health inequalities. Our research also indicated that clinicians often lacked agreement on which patients might benefit from a telehealth consultation. A lack of digital skills amongst clinicians and a lack of guidance on how to carry out telehealth consultations were also reported. However, we must also recognise the huge potential for telehealth to revolutionise the way healthcare is provided, giving patients an alternative method of accessing the care they require, reducing the burden of treatment for patients with long-term or multiple health conditions, providing access to populations who otherwise find it difficult to access traditional face-to-face appointments, the ease of carrying out joint appointments with other members of the multidisciplinary team, and contributing to a greener, more sustainable National Health Service. We know that digital expansion is cited as a key priority of the NHS long-term plan, with the aim of reducing face-to-face outpatient appointments by up to a third. And research in a variety of UK NHS services also indicate that patients and relatives have reported that telehealth appointments are highly acceptable and they wish they had been available sooner. To ensure the potential benefits of telehealth are realised and the potential inequities are mitigated, AHP services require clear, standardised guidelines to ensure telehealth is introduced fairly and equitably, with guidance and appropriate training for staff to ensure it benefits the service and its patients. I'll now pass over to my colleague, Aoife Healy, who will introduce the policy framework.
Morning, I'm Aoife Healy, Associate Professor of Human Movement Biomechanics in the Centre for Biomechanics and Rehabilitation Technologies here at the University. The background work to this policy brief started in September 2020 when we conducted research to examine the impact of the COVID-19 pandemic on orthotic service provision in the NHS. We found the introduction of telehealth for the first time in many services to ensure patients could continue access to care. While widespread use of telehealth developed in response to the pandemic, it is here to stay as it is part of the NHS digital transformation plan. The pandemic has just accelerated its introduction. This initial research led us to conducting research that was part funded by Public Health England through the British Association of Prosthetists and Orthotists to review telehealth use within allied health professional services in the NHS. This work identified that existing guidelines for telehealth consultations do not adequately support allied health professionals. Specifically, they lacked information on safety considerations, training requirements, and patient suitability criteria. Through this work, we also surveyed AHPs and AHP service managers about their experiences of using telehealth for their patient consultations. Among the clinicians and services represented, approximately 90% were using telehealth consultations to deliver healthcare, and most of these services plan to continue their use after the COVID-19 restrictions were lifted. The most significant barrier reported by participants as impacting a patient's ability to conduct a telehealth consultation was a lack of technological skills, followed by a lack of technology for patients. They were also identified as the primary disadvantages for telehealth for patients. Many clinicians reported that telehealth consultations reduce the cost of parking and transportation for patients attending hospital appointments. The benefits reported by clinicians included saving on travel time and costs and enabling flexible working, while the benefits to AHP services included increasing flexibility for patients in how their appointments were conducted and reduced potential exposure of staff to contagious diseases. From our research, we concluded that widespread adoption of telehealth in its current form in NHS AHP services may exacerbate inequalities in healthcare access for vulnerable groups with limited digital literacy or access. As a result, telehealth may be deemed inappropriate and underutilised, which would nullify the potential benefits such as sustainability, patient empowerment, and reduced treatment burden. This could increase disparities in healthcare. We conducted further analysis of the survey data to examine the organisational readiness of AHP services regarding the implementation of telehealth guidelines and staff training. Results showed that UK NHS AHP services lacked clear and comprehensive guidelines and the necessary skills to deliver effective telehealth. Vulnerable individuals are excluded from current guidelines, which could exacerbate health inequalities and hinder the success of the NHS digital transformation. The lack of national guidelines underscores the need for consistent AHP telehealth guidelines. The final piece of the puzzle was to investigate the potential barriers to the adoption of telehealth posed by differences in the NHS tariff. To understand the effect of these changes on reimbursement for AHP telehealth consultations because of the pandemic, a Freedom of Information request was sent to all clinical commissioning groups in England in April 2021 to request information on the current tariffs for face-to-face and telehealth consultations for AHP services. Results showed significant variations across the NHS in England, with some clinical commissioning groups paying the same amount regardless of the mode of delivery, some paying 6.5 times more for in-person consultations, and only a few paying more for telehealth consultations. Following these findings, we set out to develop a framework to guide allied health professional telehealth patient consultation guidelines and training. We engage with national and international stakeholders, including the professional bodies of the UK allied health professions, to ensure the framework meets the needs of allied health professional services with the aim of improving patient care. I would like to take this opportunity to thank all the stakeholders who contributed to the development of the framework. This development work was supported by Policy Impact Acceleration funding from Staffordshire University. I am pleased to introduce and welcome our Vice-Chancellor, Professor Martin Jones, who will be providing us with some background on this project. We are grateful to have him here today despite his busy schedule. Thank you, Professor Jones, for taking the time to join us.
Thank you, Aoife. Can I extend the warm welcome on a snowy morning in Stoke-on-Trent to you online. Good morning, colleagues. I'm thrilled to present at this launch event, of course recognising the dedication and efforts of all our staff involved in this programme of research that not only bridges, I think, the gap between basic and research application in the real world, but also showcases the impact of research on policy development. As a civic university, we are deeply engaged with the community and committed to addressing local and regional needs. We have several initiatives that have a strong focus on community outreach, public service and of course civic engagement. Our university community have a particular emphasis on addressing issues related to equity, diversity and of course inclusion, and our staff and students are actively involved in development projects and initiatives, and we host events and workshops to bring together community members, policymakers and academics to address local, national and international issues such as those today. The research carried out by our Centre for Biomechanics and Rehabilitation Technologies covers a wide range of topics, from lab experiments to understanding scientific principles, identifying the needs of patients and healthcare professionals, and of course developing new technologies. Recently, Professor Chokalingam and his team have begun an ambitious programme of initiatives to shape policies. Of course, some of you who are participating in this event today may be familiar with our work, which is supported by organisations such as the World Health Organization, WHO, aimed at creating policies and guidelines related to assistive technology. In addition to their work on assistive technology, our colleagues have been investigating the challenges and issues relating to the healthcare workforce, as well as the obstacles that patients, of course, face in obtaining appropriate treatment, as we've heard already. This includes looking at the factors that influence the availability and distribution of healthcare professionals, as well as the barriers that face patients, of course, when trying to access care, such as financial, geographical, of course, cultural barriers. This research helps to identify the areas where policies and practices need to be improved in order to ensure that patients are able to access the care that they need, and that healthcare professionals have the resources and the support that they also need to develop high quality care. Furthermore, this research can also guide the development of interventions and programmes aimed at improving access to care and addressing workforce shortages, which can lead to better health outcomes for the population, as we've heard. Now, as a geographer, my work focuses on place-based research and understanding of the connections between people and the physical, social, environmental, economic conditions such as neighbourhoods, cities and regions. And this is really important to look at this in the influence of health and well-being. The pandemic, as we've heard, and highlighted the ways in which physical, social and economic environments of different places can influence health outcomes and indeed exacerbate existing healthcare disparities. The pandemic has also shown that people living in disadvantaged neighbourhoods or in areas with high levels of poverty are more likely to be infected by the disease, and also to experience more severe outcomes. Researchers have been studying the ways in which these social determinants, such as income, race and place and educational levels, indeed influenced health outcomes during the pandemic, and how the pandemic has further exacerbated existing disparities. Additionally, the pandemic has also affected the accessibility and availability of healthcare services, as many health facilities have been indeed overwhelmed and have to redirect resources to manage the influx of patients, as we've seen in recent months, of course. The pandemic has also highlighted the importance of telehealth and virtual care, as well as the role of community-based healthcare organisations in providing care to underserved communities. As Nikki mentioned previously today, our colleagues have conducted a thorough analysis of the deficiencies in telehealth provision within our National Health Service over the past 2 years, with a specific emphasis on the contributions made of our various allied health professionals. Through this research, they have developed this framework today. Up next, Enza will be discussing the key components of this framework and providing insight on how we anticipate it will affect healthcare systems in both the UK and also internationally. Before we proceed though, I would like to extend my congratulations to this team who've been responsible for creating this incredible framework, and also to extend my gratitude to all the stakeholders, lots of you online today, who've been involved in this development. I'm extremely happy to be releasing this framework today, and I'm hoping and hopeful that it'll be swiftly implemented by all the stakeholder organisations involved. I truly believe that this framework will have a positive impact on healthcare provision, and indeed it will help to improve access to care for patients, especially those living in remote or underserved areas. The framework is also flexible enough to be adapted by other healthcare systems globally. It can travel. I'm confident that this framework will be a valuable resource for policymakers, professional bodies, professionals and also clinical services. I truly believe it will help to develop and implement healthcare guidelines and training programmes. Thank you indeed for your participation today.
Good morning, I'm Enza Leone and I'm Research Officer in the Center for Biomechanics and Rehabilitation Technologies at the university, and I'm currently completing a PhD in physiotherapy at Kiel University. We are happy to share our framework with you today, which you can now download from our center's blog page. Our policy brief includes a framework for guiding principles for HP telehealth consultation guidelines and a list of considerations for staff training for telehealth consultations. While the framework should be considered while designing HP telehealth guidelines and implementing telehealth in clinical practice, considerations for staff training aim to guide the development of staff training for telehealth to make sure HPs have the skills necessary to deliver telehealth patient consultations. The framework for HP telehealth guidelines presents 3 key telehealth domains, which should be simultaneously present in telehealth guidance to ensure that guidelines are comprehensive and multidimensional. These domains are implementation, financial, and technical considerations. Within each domain, there are subdomains that might need to be considered while designing telehealth guidelines. Under the implementation considerations, there are factors guiding clinical decision-making, such as patient suitability to telehealth, and telehealth organizational aspects, such as the different figures involved in remote consultations, clinical notes, and patient records. Technical considerations comprise aspects related to telehealth technical elements, such as session, technical, and training requirements, and how these aspects can influence key issues, such as privacy, risk, and safety. Telehealth consultation cost, reimbursement, and insurance coverage fall under the financial considerations. In line with the framework for telehealth guidelines, considerations for staff training for telehealth consultations include both implementation and technical considerations. Implementation considerations comprise telehealth, clinical and practical aspects in which HPs should receive training, such as how to conduct a risk assessment prior to a telehealth consultation, how to conduct a clinical assessment, how to provide treatment remotely, and how to deal with distressing conversations and emergencies during telehealth. With regard to the technical skills HPs should have to conduct telehealth, HPs should be trained on how to use the software and hardware required for telehealth consultations. The recommendations we propose for telehealth guidelines and training are comprehensive but not exhaustive. Therefore, they should serve as a basis for designing guidelines and training and for facilitating further discussion on the essential telehealth components. As we recognize the possible multiple telehealth applications and the differences between and within individual HP professional groups, our recommendations are not profession-specific. Any HP profession can use these recommendations, but adaptation to the context of use and the individual circumstances might be needed. Similarly, HP services might have different levels of digital maturity, and previous telehealth experience and digital skills may vary from one clinician to another. Using our training recommendations as guidance, we suggest that training should be tailored specifically to the needs of the HP staff of each service to ensure a successful long-term implementation of telehealth. Here I have outlined an overview of the information provided in our framework. Please download the complete document from our blog page. We now have a message from Claire Aldrich from the Chartered Society of Physiotherapy and Peter Iliff, Chair of the British Association of Prosthetists and Orthotists.
Good morning. My name is Claire Aldridge and I'm a physiotherapist and a professional advisor at the Chartered Society of Physiotherapy, the CSP. Further to supporting our members through rapid service changes, seeing many services move to telehealth or remote consultations as we refer to it at the CSP across 2020. The CSP commissioned a large-scale national evaluation of remote physiotherapy services undertaken by the research team at the University of Manchester. Further to the findings, the CSP created remote consultation recommendations aimed at embedding telehealth as part of future service development. You can see next to me we have our little roadmap signifying the journey that we're still on as a profession to being able to utilise our remote consultations or telehealth effectively. The CSP remote consultations recommendations headline is that telehealth should be used in a hybrid model of service delivery alongside options for patients to be seen in person. Decisions to undertake telehealth must be personalised to the patient with shared decision-making used, flexible across their period of care, undertaken considering multiple factors such as patient communication needs, resources available and population health needs. Including telehealth in the hybrid approach is an important component in ensuring that the right type of service is delivered at the right time for each individual. Done effectively, utilising telehealth as an option in patient care can be both convenient and empowering for the patient and potentially have positive impacts on factors such as health equity in services. However, done poorly or overly prescriptively in an under-resourced service or in an under-supported team, then the opposite can be experienced. Therefore, we hope that resources such as the Staffordshire University policy brief on healthcare patient consultation guidelines and training will support services to develop and evaluate to optimise patient care when using telehealth. So thank you to Aoife Healy and the Staffordshire University team for including the CSP in the Insight Group.
Good morning. My name is Peter Iliff. I'm the chair of the British Association of Prosthetists and Orthotists. At BAPO, we were delighted to support the background work which led to the development of this framework. The role of telehealth within health service provision has become so prominent in the last few years. As it will continue in this way, it's important to ensure a successful implementation into healthcare services like the NHS. The research carried out by the team at Staffordshire University has highlighted the deficiencies in current telehealth guidelines, which could exacerbate health inequalities, and highlighted that AHPs felt they lacked training in many aspects of telehealth, such as safety-related aspects. I commend the team for bringing together a wide range of AHP stakeholders to build on their research and to work collaboratively to develop this framework, which aims to support patient care. Like many professions, BAPO has recently updated our appointment standards to include telehealth. Therefore, I know that this framework will not only be of great use to our profession, but also across all allied health professions in the UK and across the world. I'd also like to extend my congratulations to the team for creating this framework and encourage implementation of the framework across all allied health profession organisations. Thank you.
Thank you for that, Peter. I now have great pleasure in introducing Nicolette from the Allied Health Federation's professional body to say a few words. Over to you, Nicolette.
Or AHPF for short. AHPF is an independent private organisation that represents 12 AHP professional bodies, including the CSP and BAPO, whose colleagues have just spoken. And the AHPF is very happy to endorse these guidelines, and we'll be sharing them with all our professional body members. As Peter said in his video, they're relevant to all professions, all AHP professions, and they're timely, helpful, valuable, and we will be sharing them with all professional organisations. So thank you very much. And thank you to everyone who put the research into this, developed them and produced the final guidelines.
Thank you, Nicolette. And of course, your support from the Federation is important and also very important for all professional bodies to adapt our framework. I'd like to thank all of the professional bodies who've supported this work, and I hope that this framework will be adapted and implemented as soon as possible. We have several individuals from various parts of the world joining us this morning, and I'd like to thank everyone who have joined us to share this occasion with us. Because of the nature of this web streaming, we didn't have an opportunity to interact with you and provide a forum for discussion. However, the policy brief and the framework is available for download. We'll send this framework as a PDF to all of you who have registered for this event. We intend to keep this document live and update it periodically. We'll be engaging with all of our existing stakeholders and the new ones who wants to work with us. In case if any of you who are joining us today from a different country who want to engage with us, please do get in touch with me or my colleagues who will be pleased to support you in whatever way we can. Thanks for joining us this morning. Have a fantastic day. Thank you very much.